BPS grounds its approach to wellness in the whole school, whole community, whole child model, also known as the WISC model. This comprehensive student-centered framework addresses school health through a combination of the ASCD's whole child tenets and the CDC former coordinated school health model. The model emphasizes the role of the community in supporting schools, the connections between health and academic achievement, and the importance of evidence-based school policies and practices. BPS addresses the 10 components of the WISC model through the BPS wellness policy to ensure a comprehensive, well-rounded approach to wellness in schools. Our BPS wellness policy was established in 2006 and is inclusive of many dimensions of health. The policy holds 8 different domains of health policies within one circular. Our wellness policy is our roadmap to wellness. When we strive to meet and exceed each policy domain, we can ensure a comprehensive wellness approach supporting the many dimensions of health. Each policy is an umbrella policy that covers a variety of circulars. Policies support schools and districts as written documents that guide efforts to create and support healthy school environments. The cultural proficiency domain of the wellness policy sets a foundation in schools that promotes health equity. While a standalone policy, cultural proficiency is embedded in each of the other policy areas. The school food and nutrition promotion domain supports the lifelong healthy eating habits of all students and staff by creating a healthy school food environment. The physical education and physical activity domain provides quality PE and physical activity opportunities in the classroom, at recess, and before and after school. Health education aims to increase health literacy through comprehensive K-12 health education that is medically accurate and age and developmentally appropriate. Healthy physical environments, including air quality, water quality, and building cleanliness, is critical to the prevention and management of chronic and infectious diseases that impact learning. The Safe and Supportive Schools domain creates a culture and climate that prioritizes education, promotes social and emotional development, and provides access to behavioral and mental health support services. Health Services provides high-quality in-school healthcare to students, and staff wellness aims to build a culture of well-being for staff in schools. In our policies, like our wellness policy, and with our decision-making bodies at the district and in schools, we use the BPS Racial Equity Planning Tool. The Racial Equity Planning Tool directs us to make every effort possible to advance racial equity by facilitating intentional and continuous community engagement, deliberately mitigating bias, and forging strategies most likely to produce equitable outcomes. The Racial Equity Planning Tool establishes a protocol for decision-making centered in equity by including the voices of and focusing on the experiences and needs of those historically marginalized in Boston, including Black, Latinx, and Asian students, families, and staff members, English learners, students with disabilities, and all of their intersections. For the Wellness Action Plans, the Wellness Council can consider the Racial Equity Planning Tool questions to ground their work in equity. These questions do not need to be answered specifically, but are meant to be a guide to ensure representation and voice, and that our goals aim to advance racial equity and eliminate root causes. The Racial Equity Planning Tool questions are highlighted in yellow at the top of the Wellness Action Plan tabs. Through the WISC model, our BPS wellness policy, and the actions of wellness councils across the district to advance racial equity and implement the wellness policy, we are striving to make BPS one of the healthiest school districts in the country.